sleep technician tonight. How are you doing? Okay. Well, I hope by the time you leave the sleep clinic, you feel even just the littlest bit better. Do you mind if I grab some information from you real quick? Okay. Give me just a moment. There we are. Alright, would you mind just confirming your name and date of birth for me? Excellent. And is that your preferred name, and how would you like to be addressed? Okay. Excellent. Thank you so much. So, I'd like to ask you a few medical history questions, if you don't mind. Okay. Are you in any current pain or any current discomfort at all? Okay. Very good. Alright. And are there any changes to your medical history that we don't have on file here? Let's see. Looks like there isn't anything out of the ordinary here. Okay, nothing new. Very good. And what about your family history? Any changes there? Okay. Very good. All right. And any changes to your allergies at all? Anything new there? Okay, very good. And what about your medication list? Is there anything different there at all? Okay. And no supplements either, right? Okay, yeah, let me just jot that down. Alright, do you happen to know the dosage of that offhand? Once a day, right? Okay, very good. What time of day do you take that? Morning or evening? Okay. Very good. All right, that's perfect. So I'm just going to set this down here. Let me go ahead and just sanitize my hands, and then we're gonna do a little vital check before we get started on your little sleep clinic session. Okay. All right. I'll be just a moment. Go ahead and get some of your vital signs, okay? Alright, so firstly, I'd like to take your temperature, okay? Just a little simple thermometer here, okay? And it's in the sterile protective case here. I'm just going to pop that out. So I'm going to have you open your mouth for me, and then I'm just going to put this underneath your tongue. So if you could have your tongue to the roof of your mouth, that would really help me out. Alright, okay, I'm just going to turn that on. There we go. Alright, and open your mouth, and this will go underneath your tongue. And if you could just lay your tongue down over that. And we'll just wait here for just a moment. Okay, very good. You can go ahead and lift your tongue up. There we go. Alright, so I'm just going to put that away to be sterilized. Alright, very good. Now if you don't mind, I would love to go ahead and just take your pulse, okay? Do you have any preference as to which wrist I use? Which wrist, rather? Okay, so I'm just going to put my 2 fingers here, my index and my middle, just on your radial artery here, just underneath the thumb. And I'm just going to be hanging on here for a little bit while I count your pulses. Okay? So if I could just have you relax for me, please. Okay? Relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay, very good. So that's going to be 80 beats per minute, which is a fairly average resting pulse. Alright? Okay, so I'm just going to sit here a little bit longer. Alright? Okay, and respirations are within normal limits. Very good. If I told you what I was doing, then oftentimes people will try to all of a sudden act normal and they don't remember how they breathe normally. They try to compensate in some way. So I'd let you know right after. Respirations per minute. Okay, very good. So we're going to go ahead and take your blood pressure, okay? Do you have a preference as to which arm we use? Okay, so I'm going to firstly pop in my stethoscope, and that'll leave my hands free. Alright, so just going to take the stethoscope here, or the sphygmomanometer, rather, our blood pressure cuff. And I've got a little dial right here that measures your blood pressure in millimeters of mercury. Right here. So I'm going to undo the cuff here and then place it around your arm. And then I'm going to inflate it with this bulb here and measure your blood pressure, and then we'll release the air with this little dial right at the side here. Okay? Alright, let's go ahead and just put this on your arm. Alright, and this part runs down your arm, and then I have the dial, and I'm just going to place my stethoscope right in the crook of your elbow here, okay? And then I'm just going to blow up the cuff. Okay, and release the air. Get the diastolic pressure. Okay, let's go ahead and do that again. That can be a little firm. There we go. Alright, that looks great. So I'm just going to unwrap the cuff. Okay. Alright, and we're just going to put that to the side. We won't need it anymore. Very good. And I'm going to pop this out. so that I can just note down what your blood pressure is while it's still clear in my mind. Right. 2 millimeters of mercury. That's very good. It's a very good blood pressure. Alright. I want to do a couple of other things that are generally part of a normal vitals check, but just a little exclusive thing we do here at the sleep clinic. Firstly, I'd like to take a look at your eyes, okay? Just have a little examination of your eyes, make sure that your pupils are responding normally for me, okay? So, I'm just going to shine this in your eyes. You can look straight ahead, you can look at my nose, whatever, okay? Just going to bring this in, okay? And to the side, and to the other side, and to the other side, and to the other side, and last side. Okay, very good. Your pupils are very responsive, which is excellent. And now I would like to take a little look inside your mouth and more particularly down your throat. So it is summertime here, and oftentimes that can lead to seasonal allergies acting up. Sometimes there are summer colds. So I want to just take a look at your throat and see if there's any irritation or redness so that we can just keep an eye on that, okay? Alright, if you wouldn't mind opening your mouth for me, and I'm just going to shine my light into your mouth, and I have a little tongue depressor that I'm going to use to just push your tongue down just a little. Okay, can you say out for me? Very good, very good, very good, very good. Ah, that looks wonderful. Okay, so we're going to throw that in the bin. And lastly, I'd like to take a listen to your heart and your lungs. Okay. Alright, so for your heart, I would just like you to breathe normally, okay? You don't have to take any deep breaths for me. Just breathe normally. Right, I'm just going to place my stethoscope on your chest. Just keep breathing normally. Good. Okay. And here. Very good. Okay, and here, just to your side here. Very good. Alright, that sounds excellent. Your heart sounds wonderful and healthy. It's got a good strong beat to it. Nice easy cadence to it. Okay. Now I'd like to listen to your lungs, and I'm just going to be prompting you when you should be breathing, okay? We can take the guesswork out of it. Alright. You could just breathe in for me and out. Breathe in and out. Breathe in and out. Breathe in So we're just doing a little, almost perfunctory sort of examination. I won't need to be listening to your back. And I won't be needing the stethoscope any longer. Okay? So your little miniature examination came back absolutely wonderful. You are a very healthy individual, and I have absolutely no concerns, okay? So I'm going to finish writing our notes here. Okay, so let's see. Very good. Okay. So now we're gonna do a little question answer here, okay? Just a tiny little interview. And I just want to ask you a little bit about your sleeping habits, how you're feeling with your quality of sleep, okay? Alright. The reason that we do that is while you're already relaxed and settled in from your examination, then we kind of just want to get a gauge of how you're feeling, and then if you keep coming back to the sleep clinic, then we have a nice little picture of any improvement or if there's anything we can do to improve, okay? Alright, so firstly, how many hours of sleep do you think that you get a night? Okay, so between 7 and 8 hours of sleep. Very good. When do you generally go to sleep? What time do you start, do you think? Okay. Wonderful. And what time do you generally wake up? Okay. That's wonderful. Okay, sometimes. That's great. So, do you often find yourself not going to bed at a set time, or is it more that you sometimes go to bed at this time, sometimes you don't, sometimes changes a little bit? Okay, so it's not very erratic necessarily, okay. Alright, and do you find that you generally wake up at the same time? You don't have to sleep in very often, or do you sleep in on occasion? Okay, very good. Alright, and how do you feel your quality of sleep is? Okay. And if you could just describe that for me a little bit, whether you feel like you're not getting enough deep sleep, or are you feeling very tired when you wake up? Is it difficult to go to sleep? Anything like that? Do you find yourself waking up very often? Okay. Okay. Right, okay. And do you happen to lucid dream very often? Lucid dreaming being that you're aware that you're dreaming and you can kind of control the dream a bit, or at the very least, you're aware that you're dreaming and you're aware that you're not awake. Okay. Do you often find you can remember your dreams very easily? Okay. Alrighty then. Okay. And is there any particular things that you would like to improve upon your sleep, things you want to work on at all? Yeah, certainly deeper, more restorative sleep would be a wonderful thing to work on. Are there any other concerns that you have for me at all? Any sort of worry or anxiety regarding any of this? Okay, alright. If at any point you do have any, just let me know, okay? Okay, so I'm gonna set this down. Right. And are you comfortable right now? Is there anything I can do to make you more comfortable? Whether it's change the temperature of the room or get you some more blankets, another pillow, anything of the sort? Okay, that's very good. So, today's triggers for sleep are going to mostly focus on examination and light triggers, okay? So we do different triggers here at the sleep clinic because some of us can fall asleep to the same things every night, but a lot of us need a little bit of variation, right? So we tend to change things up every day and bring new things in, phase out some older things. We have a revolving door of different triggers. So this one is oftentimes a very effective one. It doesn't take too much talking necessarily, but we do a little bit of narration, if you will, while we're doing it, just to make sure that you're aware that we're still here, okay? Alright, so if at any point you feel any pain or discomfort, please let me know, okay? So, firstly, I've got a magnifying glass. And the way I'm going to be using this magnifying glass is I'm just going to be looking at your face and the surrounding areas and just very thoroughly examining your face. Okay? So, I'm just going to take this and I may employ the use of our little pen light at times to make it easier for me to see. So, I'm just going to come in very closely, okay? And just going to bring in the magnifying glass, and I'm just going to take a look. So I'm going to start here at the hairline, okay? And just examine very thoroughly along the hairline. head up so I can look the underside of your chin and around your neck, okay? Alright, there we go, okay. There isn't generally anything of concern in this area, but it's good to check anyway. Okay. Very good, and I'm just going to take a little peek at your ears, okay? So I'm just going to come in right around here and take a little look at the ears and just note if there's anything of note going on. If there's any redness or irritation or swelling, okay? Alright, and then the other side here. Just coming in to see if there is any signs of any scratches or lesions or anything we have to worry about, but it looks pretty good, okay. Alright, so now I'm going to do just a very general little run through of everything that we've looked at so far, but I'm going to do it with our pen light this time, just to make sure that I got everything, okay? So I'm just going to take a little look at the hairline, okay, and the forehead, alright, and the cheek, and the nose, and the other cheek, and underneath the nose, and the lips, and the jaw, and the other jaw. Okay, and if you could lift up your chin, I'm just going to look in that area as well, right? And then the ears, okay, and then the other ear, Alright, I am quite pleased with how your skin looked upon examination, okay? So now we're going to move on to our light triggers here, okay? We're going to be doing a few different things here. We're going to be doing some different eye tests, and then we'll just be kind of playing around with the light a little bit. So at times this may be very slow and smooth, and at some points it might be a little fast, maybe a touch chaotic, but I try not to do things to be chaotic, but more just fast. Alright, so let me know if at any point any of this bothers you, okay? Alright, so let's go ahead and do the direct consensual response test. I'm going to put my hand up between your eyes here, and I'm going to bring my light in on one side. The eye that I shine this light into, this one here, should react to the light when I bring the light in. That would be our direct response. If I were to do that same maneuver and look at the other eye instead, then this eye should react at the same time in the same way as the eye that the light is shining into. And that would be our consensual response, as both of your eyes are consensually reacting to the light. Okay? I want you to just look straight ahead for me. Okay. I'm going to put my hand up between your eyes. I'm just going to look at the direct response there. Very good. And the consensual response. That's excellent. Put my hand up and do the other side. consensual response. That's excellent. Now I'm going to be doing the swinging light test. Very similar to what we did in our examination, in which I bring my light to one eye and then swing it to the other, and the other, and the other. Okay? Right. Just looking for any defects in the way your eyes react. Back and forth to the light. Very good, very good, very good, very good. Just keep looking straight ahead for me. Very good, very good, very good. Okay, that's excellent. So now we're going to be doing a little bit of follow the light. This tends to be a favorite for a lot of our patients here. So what I'm going to have you do is I'll have this little light on, and I want you to focus on it using only your eyes without moving your head, okay? So you're keeping your head still and only using your eyes to follow the light, okay? So I want you to just look at this light, okay? And then just follow this light, okay? Follow the light. Keep following the light. Very good. You're doing perfectly. Perfect, perfect, perfect. So we're gonna do one pass of slow movements, and then we're going to be going a little fast, okay? Just keep following the light. Very good, very good. Up, down, to the side, and to the side, okay? And let's go diagonally up and diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. Very good, okay? And I'm just going to bring this light in real close for your accommodation reflex. Just bringing it in and out. And in. Good. And out. And in. And out. Okay, so let's do that all again. This time we'll go a little faster, okay? So keep focusing on the light using only your eyes without moving your head. And we're gonna just go real quick here. Keeping you on your toes. Just very quick little movements of the light. Track it as best as you can. Okay? We'll go up. We'll go down. We'll go to the side. We'll go to the side. We'll go up. We'll go down to the side and to the side, diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, and diagonally up. Very good. Let's do that accommodation reflex. So keep focusing on the light here, okay? We're gonna bring it in and out, and in and out, it out. Alright, very good. That's all you needed to do there, okay? So, now as far as our light triggers go, I'm just going to be bringing the light in. I'll get real close. Maybe I'll get a little far away. Okay. Bringing it in close. Getting a little farther away. I'm just going to be bringing the light in and out of your field of vision. Almost like I'm examining you a little bit. I'll come out and look at you. And then I'll come in and look at you like that. Switch hands and come in and look at you here. And then bring it out. Okay. It's a little unpredictable. Unpredictable. Don't you just love that word? Unpredictable. It's almost a little chaotic, but you have the sounds, the rustling sounds of the fabric that I'm wearing. You have very smooth and fluid movements, rather. You have the light coming very close in, right here, and then coming back out. You have a little bit of examination as I just get real close into certain parts that I'm looking at and then move away to get a better look. It's a little bit all over the place, but we're combining different triggers to hopefully perhaps get you off guard and give you a good ASMR response. Sometimes we have to try some things that we would never think of. Sometimes we have to try different speeds, different things in order to get a good ASMR response. And sometimes we have to try different technicians. And sometimes it's just a matter of being at the right technician, at the right video, at the right time. Sometimes it's about unpredictability. Sometimes it's about being a little surprised. Sometimes it's about something that's a little new, right? Just gonna circle the light a little bit here. Just circle. Just very small little circles here. But I think sometimes it's about just changing it up a little bit. Changing it up a little bit. Okay. Very good. So, that was a bit of an experimental bit, but to leave you off, I'm going to do some of our classic triggers that we've already done just once more in case that experimental procedure wasn't so much your bag. I don't want to leave you hanging, okay? Alright, so I'm just going to be doing our direct consensual response test again. We'll do the swinging light test, the follow the light, and the accommodation reflex, okay? Alright, so firstly, we're going to do the direct consensual response test. Direct. Direct response. Consensual. Consensual. Very good. Consensual. 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 Very good. Let's go ahead and do the swinging light test again. Okay? Just going to bring our light in. And the other side. And the other side. The other side. The other side. And the other side. Okay, let's go ahead and do that follow the light test again. We're just going to take it real slow. So just follow the light using only your eyes without moving your head. Okay? Follow the light using only your eyes without moving your head. Very good. Very good, very good, very good. You're doing excellently. Excellently, excellently. Let's go up and down, side, and side, up, down, side, and the side, diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. For the accommodation reflex, we're going to go in and out, and in and out, and in and out. Let's do that for the other side.